All right, well, welcome everyone. Welcome to our Age Well series presentation, August edition of 2026. My name is Jill Rankin. I'm the Executive Director for the Wisconsin Institute for Healthy Aging. And if you don't know our organization yet, we're a nonprofit and we work with the whole state of Wisconsin. Our mission is to provide evidence-based healthy aging resources and programs to our communities throughout the state of Wisconsin. We also work nationwide as well with several partners. We partner with amazing organizations throughout our communities who implement beneficial healthy aging programs and work with large statewide healthy aging initiatives. So, part of that initiative is to provide health education in these Age Well series events, where they're short 1 hour presentations that get us started on a wide variety of healthy aging topics. So, before we go ahead and introduce our speakers, I'd like to introduce and hand over the welcome to one of our sponsoring partners. So we have John Schnabel with us with the Greater Wisconsin Agency on Aging Resources. So, John, I'll hand it over to you.
Thank you, Jill. And good, I guess we're in afternoon. We're officially in afternoon now, and good afternoon to everyone. Glad you could attend. And my name is John Schnabel, and I'm the Executive Director here at the Greater Wisconsin Agency on Aging Resources. And we are a 70 county, 11 tribe area agency on aging in Wisconsin. We are a proud supporter of WEHA and its mission. And through the Federal Older Americans Act, we support one of the things that we do is support evidence based health promotion programs throughout the aging and ADRC network in the state of Wisconsin. So happy to be with you today. Happy to be a sponsor of WEHA, and I hope you enjoy the next hour.
Wonderful. Thank you so much, John. Great having you with us today. So we will then introduce our speakers. We have Juliet Sirkins and Wynn Wyman with Center for Hearing Access at the SHED Institute. So we're really excited to have these speakers. We've been partnering with Juliet for quite some time over the past years. If any of you are familiar with their work, they have been featured at WEHA's Healthy Aging Summit in the past, and will bring a wealth of information and knowledge to us on hearing and healthy aging with hearing loss. So I will hand it over to you, Juliet.
Juliet, you are in mute. Oh, we still cannot hear you.
Are you able to hear me right
There we
now?
go. Yes.
All right, good. Well, that's not a very smooth start of this presentation, but we would like to bring just a lot of information today about hearing loss, about hearing aids, about healthy aging, and we have a lot of information prepared. There's going to be a lot of links, and those are all going to be available in the slides later on. And Jill already introduced us very briefly. I'm an audiologist. I reside in Oshkosh, Wisconsin, and I have been a consumer advocate for people with hearing loss and for improved hearing access since 2012. So I do a lot of lectures for consumers. And WIN is located in Denver, Colorado. And we both work very hard to keep the website Center for Hearing Access active and with a lot of useful information for consumers. So the website has links, has handouts. There is a library of all kinds of links to articles that pertain to hearing and hearing loss and hearing access. Um, We really are working very hard to have information about the ADA, the Americans with Disabilities Act. That's all going to be on this website. And a lot of the information that we're going to be sharing today is available on that website, centerforhearingaccess.org. And just a quick disclaimer slide, we are not here to give you legal or medical advice. We are going to be showing some products, but we are not necessarily endorsing them. We're not trying to exclude other products. We have no financial interest in any product. We are both consultants with the Center for Hearing Access. And our hopes today is that you will learn more about hearing loss, about the effects of hearing loss, and learn more about the options that are out there to hear better with and without technologies. This is not just about hearing aids. So we're going to be talking about hearing loss, about hearing aids, but then also about the technologies beyond hearing aids, and a little bit about self-advocacy. If you don't speak up, nothing is going to happen. So let's first talk a little bit about hearing loss. Estimates range that hearing loss affects 1 in every 5 persons. That doesn't mean that every one of those 5 persons needs amplification, but their inability to hear in some circumstances affects their life one way or another. What is very clear from this slide from Johns Hopkins is that the incidence of hearing loss, the rate that we experience hearing loss as we age, dramatically increase as we get older. And I've joked for years in this area, you got to choose your parents wisely. And my father could stand under a smoke alarm and not hear it. And my mother, who's 99, has been wearing hearing aids now for over 20 years. And you can see that when you go beyond 70 and 80, the percentage of people with mild and moderate hearing loss increase dramatically. By the way, 98% of the people who experience hearing loss use spoken language. They do not use sign language. We estimate that less than 1% of the people of the 72 million people use sign language, and less than 1% use some form of tactile communication. And hearing loss, when it's untreated, can contribute. It can contribute to people feeling more tired. Well, yeah, they have to put in a lot more effort every day to hear and to piece things together. It leads to irritability between spouses and anger. Ask any spouse who lives with a person who has hearing loss. It contributes to depression, to social isolation, to overall reduced quality of life. It also contributes to not remembering well. And there is an increased risk of falls and accidents, and may contribute to an earlier onset of dementia. So the Lancet Commission back in 2020, and that report was updated in 2024, identified hearing loss as the single largest modifiable risk factor for dementia. We know that the risk factors for dementia are depression, our social isolation, our physical inactivity, smoking, air pollution, but they have put hearing loss at the top of that risk. And it's generally assessed that about 8% of all cases of dementia are attributable to not hearing well. And then the Achieve study, and it was a randomized controlled trial, found that when you treat hearing loss, it can measurably slow cognitive decline in the group of adults who were at risk for cognitive decline. They concluded that hearing intervention can slow down the loss of thinking and memory abilities. And then the third risk of hearing loss is false. You're in the kitchen. You don't hear that the dog walked in the kitchen tripping over the linoleum, and you turn around and you trip over the dog. It was the dog that made you fall, but it was your inability to hear that the dog had entered the kitchen. So the suggestion is given here that if you have hearing loss, you should really start to develop strategies to reduce the incidence of falls, and frequently that means exercising. Now, what does hearing loss look like or feel like in the real world? And it really looks like misunderstanding. It's the three gentlemen on the beach. One says it's windy. The second person says, no, it's Thursday. And the third one says, so am I. Let's have a beer. Obviously, there's a lot of miscommunication going on. So hearing loss is measured and recorded in an audiogram. And what you're looking at, this chart, is called the audiogram. Red circles represent the hearing ability in the right ear, blue X's, hearing in the left ear, and loudness is shown on the side of the graph, from 0 being very, very quiet and 100 decibels being very loud. And it's said that if your hearing is in the range of 0 to 20 decibel, a person has normal hearing. At the top of the graph are the different pitches that audiologists measure under earphones. Normal human hearing range when we are born extends all the way to 20,000 hertz, but hearing testing is generally done only from about 250 to 8,000 hertz, and those numbers are shown here at the top of the graph. Now, you're probably wondering, what are those red dots doing in the audiogram? Well, the more dots are heard, are audible, are heard above the hearing threshold of a person, the more speech energy is perceived. And we also call this area the speech banana because it kind of looks like a banana. Every dot is worth 1% of speech understanding. But some dots are more important than others. The low frequency sounds in the audiogram give us the timbre, the emotion. You can hear if somebody is happy or sad or in a hurry. Those are in the low frequencies. In the high frequencies, those tones are important for the meaning of sound, for comprehension of speech. And I'm going to show you in the next slide why that is important. Now, in this chart, you can see this person with normal hearing in the left ear, normal hearing in the right ear, has no trouble hearing this speech information. And again, why is that important? The vowel sounds carry the speech volume, but the consonants carry the speech intelligibility. So if you only hear high frequencies, you can easily make out this sentence. You're hearing all the consonants. The Packers didn't play in the Super Bowl. But if you're only hearing the low frequencies, then you will only hear the vowel sounds, and it becomes much more difficult to make out what I'm saying. I love to grow tulips in my garden. So the typical complaint of a person with high-pitch hearing loss, which by the way is the most common type of hearing loss, leads to the very typical complaint. I can hear, but I can't understand. So even with significant hearing loss, a lot of people say, but I can hear. Let's go into an explanation of that. Again, here's a person with normal hearing, is able to hear every dot, and that person is said to have a speech intelligibility index of 100, can hear fine. If that person goes into a bar or into a restaurant where there is a lot of noise, the noise will mask the low pitch hearing, the vowel sound hearing, the part of the hearing that isn't super critical. Still has enough audibility of the high frequencies that he or she is able to converse even in high levels of background noise. Now, let's look at a person who has high pitch hearing loss. This looks very much like my mother. And here is the hearing in the left ear showing a very, very mild hearing loss in the low tones, significant hearing loss in the high tones. That person in quiet hears 56% of the speech information. But that's enough to make out what people are saying. She still has to pay very close attention, but she does okay. Now, you mix in background noise with that same degree of hearing loss, and now this person's hearing ability is relegated to this little area that's above the hearing threshold. And that's only 26%. And that's exactly what people complain of. I can hear okay when it's quiet because they hear okay here, but in background noise, they fall apart. They are no longer able to fill in the gaps. And that's what happens then at home. The wife will say, I think you need a hearing test. And because the person has some high pitch hearing loss, says, why the heck do I need a hairy chest? Because he misunderstood what she said. So let's talk about how to evaluate one's hearing needs. And this is one of the first practical tools that we have here for you. It's called the Paper and Pencil Quick Hearing Check. And that check can be found on the Center for Hearing Access.org under the term Winchester. Put Winchester in the search bar, and you'll be able all my handouts for lectures pop right up. And this quick hearing check allows you to answer questions that pertain to hearing. I have a problem hearing over the phone. If you disagree, you circle a 0. If you have a lot of trouble, you circle a 4. There's lots of questions there. I misunderstand what people say. I have trouble determining where the directions for sounds are coming from. My family members think or have told me I may have a hearing loss. And again, you circle what applies to you. And on the back of the form, it allows you to score that test. Now, our recommendation is that you take the paper and pencil test, but you also ask someone you know well to take the test for you and rate your ability to hear. And that allows you to compare scores. And it really is meant to be an opening tool, a tool to open conversation. Because if you say, I have no trouble hearing the TV, and your wife says, yes, you do, honey, because the TV is super loud, then at least you'll know what your hearing loss or what kind of an effect your hearing loss is having on your spouse. Generally, a score of over 20 merits an audiological evaluation. That test has been validated, and there's a very solid research paper behind that. So next, we'll talk briefly about hearing instruments. And we're going to start with, before you even get hearing aids, about talking about communication strategies. And again, there's a handout on the Winchester page on the website. It's a one-page handout, and it's titled 10 Things Someone with Hearing Loss Wishes Others Would Know. So if you're here watching this lecture because you live with someone with hearing loss, you may want to read this over. But if you're the person with hearing loss, this may be a handout you could share with your family members. And a lot of these are common sense, getting attention, calling a person by name, just like Alexa. Alexa won't respond unless you say, Alexa, what's the weather today? And so it's really helpful for if you live with someone who's hard of hearing to say, honey or sweetie, because that perks up their ears, and then to ask or to say what you wanted to say. On this handout are also helpful hints for smartphone users, how you can turn the captions on your smartphone on. And I think the number 10 is a really important point on this handout. Hearing aids are not like glasses. They do not correct hearing to normal. Then talking about hearing aids, and there are a number of options available if you have beginning or mild hearing loss, and they're called over-the-counter hearing aids. And there was a good article in the Consumer Reports about over-the-counter hearing aids, but there are some limitations with over-the-counter hearing aids. You're the one who has to adjust them and fit them. They generally do not have Bluetooth or telecoils so that you can use them in conjunction with your smartphone, but they are an option for people who only need help in limited situations. And we give you a lot of resources here, including the website of the American Hearing Loss Association. They give over-the-counter tips, the American Speech and Language Association. And all these links are going to be active when you access our slides. But the truth is, many consumers need the help and the expertise of an audiologist. And frankly, the most important choice that you're going to make is not the kind of hearing aids that you're buying or the features in the hearing aids. It's the professional that you're going to be working with. So you have to choose wisely. How do you choose a hearing care provider? There's a number of different locations where audiologists and hearing instruments practice. But one of the sources that we highly recommend is the Hearing Up Network. This is a network of audiologists who have agreed to follow best practices and do really solid hearing instrument fitting services. But you want to look for a professional who's patient focused, who has been there for a long time, somebody you mesh with, because this is a long-term relationship, someone who performs speech and noise testing so that they have a good idea of how well you do, not only in quiet with hearing loss, but how well you hear in background of noise, and who does specialized testing with the hearing aids once they are fit. And there's handouts coming up on that very topic. So regarding prescription hearing aids, we highly recommend the Wisconsin Hearing Aid Buying Guide. And again, there will be a link on the website under the name Winchester for the Center for Hearing Access. Important is that your provider asks you a lot of questions about your hearing history, about your noise exposure history. There's a very thorough examination of your ears, measures your ability to hear speech in background of noise, and then goes into, in effect, a plan for your type and degree of hearing loss and your specific needs. And this handout has a whole page on what the hearing care provider should be reviewing with you, and then what the recommendations are going to be and what goes into those recommendations. We highly recommend that you bring your paper and pencil hearing test results with you, because that will list some of the situations that you experience hearing difficulties in. And again, there's the website for the handouts for today. And then the difficult decisions have to be made. How do you decide what kind of hearing aids to choose? There's different models, different makes, they fit differently in the ear. A lot of those decisions are driven by your degree of loss, your anatomy, whether you make earwax in your ears, your budget, your dexterity, how easy or how hard it is to handle some features on hearing aids. Uh, but it will also, you need to decide, your preferences for wearing the hearing aids or style of hearing aids. And in some cases, it may also be dictated by your insurance company. There are a lot of features to choose from, but the built-in features that need to be specified before the purchase of the hearing aids are whether you have um, technology built in that lets you connect to other devices, such as a TV, such as your smartphone, such as assistive listening systems in churches or in theaters. And for that reason, we highly recommend that your hearing aids include a telecoil and include a new technology called Auracast. And we're not the only ones who are recommending this. The Consumer Reports recently had a nice article on the web. We'll provide you with links to that. AARP recommends this, as does the Hearing Loss Association of America. And then there's other features that may or may not be included with your hearing aids that can help you hear better in noise, directional microphones, noise suppression. Artificial intelligence is starting to make an appearance in hearing aids, so there's a lot of decisions to be made. Important questions for you to ask the provider, especially when this is the first time you're doing this. What is your typical trial period? Many professionals offer more than the Wisconsin state mandated 30 days. A lot of professionals offer 60 days or even 90 days on a trial of hearing aids. And you also need to know in writing what portion on the cost of the hearing aids is non-refundable should you return the hearing aids. You also need to ask if the hearing aids are open or locked. Locked hearing aids are hearing aids that by brand alone can only be adjusted by professionals who work with that brand. And so we are huge proponents of open hearing aids and locked, because if you move, if you go somewhere else, another audiologist may not be able to adjust these hearing aids. And then, is it possible to compare different makes or different levels of technology? You're entering a long-term relationship with a provider, and it's important that he or she instills trust in you. So what can consumers expect from well-adjusted and verified hearing aids? Number one, much better hearing in one-on-one situations, at normal conversation distance. And normal conversation distance is about 2, 3, 4 arms lengths. If you're married to a spouse with a loud voice, that could be a little bit further. If you're married to a person who speaks very, very quietly, that distance consequently is going to be less. It's also important to keep in mind that hearing aids correct at best about 50% of your degree of hearing loss. Hearing aids will work optimally where it's quiet, should work okay in smaller groups if there isn't a lot of crosstalk or background noise. But in background of noise, many hearing aid users complain that their hearing aids are of limited benefits. If those situations are important to you, you need to start looking at additional technology devices that work with your hearing aids to overcome the difficulties you experience in those situations. And those could be like a TV streamer, we'll talk about that, or a remote control. And most users benefit from what is called assistive technology in public places, such as theaters and meeting rooms and churches. So we're going to be talking about that some more. I'm getting to the end of my portion of the lecture. I'm just going to have just a few words about tinnitus, and that's because the majority of people who have hearing loss also complain of tinnitus, buzzing, hissing, ringing, clicking sounds in their ears, even though there's no sounds happening around them. Typical causes, like I mentioned, hearing loss, but it can also be loud noise, ear infections. It can be earwax, though it rarely is, and some medications can cause tinnitus. And tinnitus certainly can affect concentration and sleep, just overall quality of life. And to some people for whom this is a big issue, can lead to anxiety and depression. Now, tinnitus is treatable, and treatments include counseling, sound therapy, and hearing aids. And in Wisconsin, I'm going to refer you to the Froedtert website on tinnitus. There's good information there and some free videos and workshops. But there's also the American Tinnitus Association that has good information about this issue that can be a huge deal for a lot of people. We highly recommend that if you have tinnitus, particularly if it's only in one ear, or if it was kind of a sudden onset, or if it's accompanied with fluctuating hearing loss or dizziness, that you seek medical help before you treat the hearing loss. And that brings me to the end of my presentation. And I'm going to let Win take it from here.
So hello, everybody. I'm Win, and introduced earlier. My background simply is about education, and just delighted that I'm with the Center for Hearing Access. So I bring all of that. Plus, I've had hearing loss since childhood, which means since it's progressive, that I've gradually been losing my hearing over time with that. And exactly what was mentioned earlier about getting attention. So in kindergarten, what happened was what my parents told my teacher, always say Win's name first, and then, whatever needs to happen with that. So I've experienced a lot, but what's different is that it's basically who I am because I've had it so long, different than people who might have acquired or it's showing up later on in life. So my second half is talking about different technologies, different ways that you can manage hearing loss or hear better. So again, just to reemphasize what was said earlier, that it's not about fixing or curing or making it perfect, that it's going to be easy, but it's saying, how can you make things clearer? How can you understand better? How can you ask for some of the accommodations with it? So I'm going to give an overview of things beyond hearing aids that can help you. So next slide, please. So the first one is cochlear implants. So it's when the hearing aids are in, but they are not doing everything that they could be doing. So if the hearing is getting worse, it might be that the volume needs to go up even more, that it's even more work to be hearing. And you might be missing from some of the conversations. So those are some of the things that you might realize, or somebody might point out to you to say, hey, it's those hearing aids just really aren't working so well. And so consider being evaluated for a cochlear implant. They have a whole protocol. So you do basically a normal hearing test, and then you have some other tests with it. The second way is a kind of a rule of thumb. So not a rigid guideline rules, but it says if you're having trouble with the clarity, and if you're having trouble with the volume, and they're calling it a 60-60 rule, so that you are not getting all of the, you have a hard time and you're not getting all of the audible sounds, as well as you're not scoring well on the word recognition. So this is the same audiogram that you saw earlier. There's the speech banana. Typically, it would be somebody who's only getting part of that speech banana. But the important thing is that you still hear sound. It's not like you have to be totally without sound to qualify. You still hear sound, but it's not enough in the right sound with that. And I've been through it. So 3 years ago, I went through all of this. So I have a hearing aid in my right ear, a cochlear implant in my left ear. It's amazing because I can hear the birds in my left ear with my cochlear, but I don't hear them with my hearing aid. But it takes a lot. I have done rehab. It takes work, and it's almost lifelong to continue to reteach your brain what it is, and to teach your brain that it's a digital rather than an acoustical sound. Next slide. Second thing that's really, really important that anybody can use, and hopefully you're using them during the Zoom session. Captions are everywhere. The technology is amazing. You know, here on Zoom, you just turn it on. Speech to text, it's pretty accurate. It's not fully accurate, but it's pretty good. You can do the same thing on your phone, and whether it's Android or whether it's an Apple phone, you can get it, as well as you have the option of getting at no cost. There's a picture at the bottom, a caption phone. You can get captions at movies. You can ask for captions in public places. Next slide. That was a lot to cover, but just know this is an overview so that you can ask, learn, try it out. So another thing you might want to look at if you don't have it is getting that clear sound from that TV direct to your ears. So anytime that you can avoid the space in between, you're going to get a better sound. So there's several ways. So like the first one is what I have. I have a transmitter on the TV. It goes from the TV straight into both of my devices. Clear sounds. Work with your audiologist to get that. Second one is that you can buy a product off the shelf. And the third one is that some of the newer TVs are coming out with a newer technology called Auracast. And that's built into the newer TVs, but you have to have a newer hearing aid to be able to receive it in your hearing aids. Next slide. Another option is to be getting a microphone to bring that sound directly to your ears. So on the left-hand side is that you can buy a microphone that's connected to your hearing aids. You can give it to your companion and they can speak and it goes straight into your ears. So if it's just the two of you at a restaurant, you can get a clear sound because you're capturing that person you want to hear and less of that background noise in the restaurant. They also come with the table microphones, but again, the further that microphone is away from people's mouths, you're going to pick up more background noise, but it can help. So on the right-hand side are for people who do not wear hearing aids for whatever reason. And, you know, not everybody chooses and says that hearing aids is a solution or their solution that they're ready for at that point for a host of reasons, but you can still get good sound or better sound. So you can get a personal amplifier, and you can see the gentleman there, he's wearing it on his shirt pocket there. He has headphones, it has a microphone, talking to a healthcare provider. Or you can take it off the pocket and put that microphone closer to the person's mouth. And we have resources, they're on the slide, you can read them, you can ask questions, and really try them out. Next slide. And then assistive listening is when you go out in public and you need the clarity. So we have, this is made in Wisconsin. And next slide, please. And so we have a video here. The first part is going to be quiet. And you're going to hear the difference about not having the sound direct to you and with it direct.
Well, what's the only way to avoid getting older is to die, right? Now, we all want to live a long life. We apparently just don't want to get old in order to... Sitting there and our young people in their 20s and 30s and 40s making fun of older people, making cracks about older people. They're making fun of what they themselves are going to become.
So if you listen to that, it's remarkably different. You can hear both of them, but the second one is much, much clearer than the first one. And so these systems are required around the country, and all you have to do is request them. They are required under the Americans with Disabilities Act. You don't have to pay for anything. You might have to sign a form when you check it out. But the simple concept is you can walk in anywhere, ask for headphones, ask for a receiver, and that's going to bring that audio directly to your ears. And there's going to be some variations of that. Next slide, please. And the variation, so the right-hand side is it doesn't matter what technology is in the place, you just get a receiver and headphones and you're going to get that clear sound. The left-hand side is if you do have hearing aids, it gets a little bit more complicated because depending on the type of technology, like hearing loops, there's hundreds of hearing loops in Wisconsin. You just have to click, get that telecoil activated that was talked about at the beginning of our presentation, and you're directly connected in, no equipment, absolutely wonderful. The second type for all of the other systems, you will need to ask for a receiver and what's called a neck loop. And the neck loop, that little green picture, shows you wear it like a necklace. It creates an electromagnetic field and it brings it up to that telecoil to your ear to get that direct sound. Much, much better to get the direct sound than putting it over your hearing aid. So next slide, please. And so what kinds of technologies, for those of you that are interested, there are three main technologies. The hearing loops are in the theaters, the libraries, city council meetings, as well as you might find FM systems and the new system, which is Auracast. You don't need to be concerned about which is the better, which is recommended. You show up and you use it. And then down below, click please, are the three other technologies that you might encounter. Not a lot of us go to court, but if you're like a CASA volunteer, you might be using an infrared system. But again, the previous slide is most important. How do you connect to it? This is just what's behind the scenes, and some of you might be interested. Next slide. Here's a partial list of all the places that you can find these assistive listening systems. So we've mentioned it at theaters, at events, at city council meetings. If you're going, like if I go to the state capitol, each of the hearing rooms as well as the main floor has them. They are required, and you can look for the two signs. We finally call it the blue ear. So that's the sign that should be posted. Usually it's blue in the United States, sometimes it's brown. And then down below, it should indicate what kind of a system they have available. They can put down whatever instructions they need where things can be picked up. But the important thing is if there's a T, that means that it's a hearing loop and that you can directly connect to it. So there should be lots of T's in Wisconsin. Next slide. And then the last is, even though you have good communication, even though you have the hearing aids, even though these captions are available, they're not going to do any good unless you do a bit of self-advocacy. Next slide, please. So the Americans with Disabilities Act is for all disabilities. And people commonly think that it's for people who have disabilities with some kind of mobility needs. But it's really for all disabilities, including hearing loss. And I love this that was developed by somebody else that it says assistive listening systems help people with hearing loss, similarly as ramps help people with mobility needs. Click. And the points with that are that we have equal access to audio at no additional cost. That's what the ADA promises for us. And some people say, well, I just have a little bit of hearing loss. That's not really a disability. I can still go on with my life. But in fact, it is considered a disability. And by saying it is a disability, that gives you the rights to be asking for accommodation in public places. Next slide. And so when you ask, this quote says, hearing loss isn't the problem. It's about the lack of communication access. And so talking about when you go into a facility, if you say, I have hearing loss, what can you do for me? That's putting the burden in the wrong places because you need to tell them what you need. Hi, I have hearing loss. I need communication access. What I need is an assistive listening system. Where can I go pick up the receiver and the equipment? That's entirely two different kinds of messages. And the more clear that you can be with what you need and what you would like to request of them, and again, requesting, not asking, because it's not a favor. It's a request that you are describing. Next slide. So these systems are supposed to be there. There are thousands of them across the country as well as around the world if you travel, and including in Wisconsin. And some of them work great. And so those staff members need to hear that it worked great. You can give them feedback. It worked great, blah, 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 blah. I love the show, blah, blah, blah. Or if things don't work well, because I guarantee that you will come across ones that are not fully working. So giving them feedback is great. Or if feedback isn't work, or if you feel a complaint can get things moving faster, a formal complaint, you can submit it. And we have tried to make it easy. Your job, if it doesn't work, is to say, hey, this is what happened, and this is what I'd like to see change. And we've tried to make it easy so that you can copy and paste or attach documents to say, here's what's supposed to be happening. Next slide. And then we've also done a section about healthcare. Where can you use captions? How can captions be used in healthcare? Can you bring along your own captioning device? Can you use a personal amplifier? What can be used with that? So again, making it easy for people. They're there, they're meant to be used. Share with your provider, print it and bring it with you, whatever you need to do. Again, just trying to make it easy to educate yourself, and sometimes the providers need to be educated as well. Next slide. And then, as mentioned, we have a ton of resources. So I'm going to quickly go through here because I've seen a little bit of some questions coming into the chat. So here's the Winchester slide where we've done pulled the main resources from this presentation together. Next slide. And then some of the videos and resources that are available, as well as some of the articles and videos that we have written or given. And you'll see Dr. Sturkins there, over 1 million views with the TEDx Oshkosh about what you don't know about hearing aids. Next slide. And then we have some additional resources about hearing aids, working with an audiologist, finding one. So some of our resources, as well as some of those that are done by others. Next slide. And then if you'd like to read books, there's different perspectives. So written by consumers are the first couple, by medical doctors and audiologists with the AARP, and then an audiologist who broke down the 5 different factors called the 5 keys for better hearing accessibility. Next slide. And we're here to Q&A. So I turn it to you, Erin, if you could ask questions, or if you'd like us to take a look and go through. Yeah.
I'm just going to share a few slides really quickly here, and then we'll open it up to the group. So if anyone does have any questions, please feel free to enter those in the chat, and then we'll review those from there. So just real quickly, when you exit out of Zoom today, we will be asking you a brief survey. Greatly appreciate your feedback in responding to that survey. Upcoming events for our Age Well series include Stay Steady, Stay Connected in September, and The Power of Your Gut, How the Microbiome Shapes Healthy Aging in October. So we'd encourage everyone to register for those events. If you did find this information helpful, we'd greatly appreciate a small donation on our website. And don't forget to check out the upcoming workshops that we have available also on our website. So I'll stop our screen share and we'll open it up to questions. I know there was one earlier on in the presentation about, can you briefly talk about, I'm not sure I'm going to pronounce this correctly, Meniere's disease?
Yes. And that is actually a disease of the inner ear that
Juliet,
can.
we can't hear you.
I'm hearing you.
Maybe it's just me.
Yeah,
Oh.
I heard you.
Okay, good.
Yeah.
Good. It's an inner ear disease that can cause fluctuating hearing loss, dizziness, and roaring, buzzing, whooshing type of tinnitus. It can respond well to medication, to changes in the diet, and it can also respond to the reduction of stress in one's life. And I mean, who right now isn't experiencing some stress in their life? But it really needs to be managed by an otolaryngologist, by an ear, nose, and throat specialist. Meniere's disease generally starts in one ear, and the hearing loss will fluctuate, but generally ratchet down, and sometimes the other ear. And I believe the percentage is between 50 and 60% of people also experience the hearing loss in the other ear. But debilitating dizziness is generally the biggest complaint before the hearing loss. So if you or someone you know experiences Meniere's disease, I believe there is an American Meniere's disease organization for more information, but you should really see an otolaryngologist.
Great, thank you. There's another question on any tips for removing hearing aid batteries from the case, especially those with severe hand arthritis.
Magnets. So the magnet is a big one. You need to ask your audiologist. Um, I've dealt with farmer patients, and they highly recommended cow magnets, but then they were really hard to get the battery off the cow magnet. But that will make it easier. I've also noticed that with some of the rechargeable batteries, they fit into the case and are kind of stuck in there with magnetically, and they're hard for arthritic fingers to take off. And so I'm almost thinking you may want to use some type of rubbery grip to grab the hearing aid out of that, because sometimes that's hard. But
And
that's definitely a question to ask of an audiologist. And you, Win, you have practical advice too?
yeah, I'm going to add because it said case. So part of it is the packaging. So the packaging
Oh,
right now, because they're child-proof, because of the
yep.
realistic concern that little kids shouldn't be eating or accidentally consuming the batteries. And right now, they're really, really hard to get. And I would say for simplicity, look for some YouTube videos, pliers and the cutters to try to do it. The thing you don't want to do is to peel off the back because that exposes it to air and that starts the drain.
Yeah, and the battery manufacturers are developing batteries that fit in screw cases that very much look like medicine, the containers that medicine come in. So this is a known problem. I was thinking of how to get the battery out of the hearing aid, but it's the battery, and I'm
That's good.
finding it's hard for me. So I use nail clippers. I use really sharp clippers to clip the plastic away. It's crazy, but it's what we're dealing with right now.
Thank
And
you.
I'm seeing, yeah, go ahead. Go
There's
ahead,
another
Erin.
question. Do motels typically have audio access resources?
So I think we'll both answer pieces with this. So the thing is, it's what do you need and to be looking for that. So you can request a hearing accessible room, which means that it might have a doorbell to notify, it should have a flashing light instead of just a siren for the fire alarm. And it might be built into the room, or they might provide a kit. But again, not everybody is aware of this. So that self-advocacy and asking for it is going to be important, as well as like captions on the TV. It should be easy to just get that remote and push the caption button, but not all
No.
the remotes have that. And so sometimes you have to go into the inner workings to get it set.
And some motels may offer like amplified phones in the rooms, but the telephones in the rooms themselves are not captioned, for example. That's where your smartphone could come in handy. If there's a speaker feature on the phone, you can lay the phone next to your smartphone and caption and use the captions that way.
Wonderful. Another question, why do hearing issues occur in one ear and not the other? And what do you recommend if you have three different diagnoses from three different ENT practitioners?
That's a tough question. Um, things happen. Some people have only a hip problem on one side and not in the other. And even though both hips have had the same wear and tear over 60 or 70 years, um, but if you feel that you're not getting to the bottom of the problem, um, it may require you to see a specialist. And if you're in Wisconsin, that would be perhaps the university in Madison, Froedtert Hospital, and or Mayo Clinic. Um, but in this case, I'm willing to communicate with you privately if you have questions, but it's really hard for me to answer during this session.
Wonderful. I'm not seeing any other questions in the chat, and we are at time, so we will close our session today. Thank you again, Wynn and Juliet, for being outstanding speakers and giving us such an informative presentation. Thank you, everyone, for joining us today.
Thanks for inviting us.
Take care.